Okay, first I'm going to show you the room that I am in. Okay. And I'm my patient. All right. Hello, Mr. Valle. My name is Jaleesa. I'm going to be your nursing student today. And today I'm going to complete an assessment on your eyes, your ears, your nose, your sinuses, and your mouth and throat. So the first thing I would do is I'm going to wash my hands and I'm going to put on gloves. So the first thing I'm going to do is I'm going to inspect the eyes. I'm going to inspect the eyelids, the eyebrow, the eyelashes, and the lacrimal apparatus. And I'm inspecting for color, edema, swelling, and symmetry, and alignment. And then the next thing I'm going to do is I'm going to palpate now. I'm going to palpate the lacrimal apparatus for discharge, tearing, or tenderness. So after I did that, and now I'm going to inspect the conjunctiva and the sclera, and I'm inspecting for color, edema, nodules, lesions, and vascularity. So now I'm going to also inspect the cornea and the iris for color, edema, nodule, lesion, and vascularity. You can look up for me. Alright. Alright. So now that I did that, I'm also going to now inspect your pupils to make sure they're equal, round, reacting to light. Alright. There you go. So after I inspected your pupils, now if you can look at that picture for me. Okay. And I'll focus in on my finger. Very good. So the next thing we're going to do is we're going to do a Snellen test. So if you can go back to where those building blocks are for me. And I'm going to have you look at the chart. And I'm going to have you cover one eye at each time. And just recite and just tell me what you see.
EFPTOZLPED PECFD EDFCZP FELOPZD DEF POTEC LEFODPCT. Can't read the other one.
Very good. Now if you can switch eyes for me.
Yeah, this side's cool.
You're okay. Whenever you're ready.
EFPTOZLPED PECFD EDFCZP FELOPZD DEFPOTEC. Okay.
All right, very good. Now if you can take a seat for me again. Oh, yes, sir. Yes, I apologize. You can go back and do it with both eyes.
EFP
You can just go back a little. Thank you.
TOZLPED PECFD EDFCZP FELOPZD DEFPOTC LET, just kidding, FODPOT.
All right, very good. Now if you can take a seat for me. So we're going to do another vision acuity test, and this time I'm going to have this closer to you. And you're going to cover one eye, and instead of reading all of them, just read me the smallest line that you can read, okay?
So 42679 EWMOOX.
All right, very good. Now your next eye.
426739EWMOOX.
All right, now both eyes, please.
426739EWMOOX.
All right, very good. So the next thing we're gonna do is check your color vision. Now I'm gonna have you just tell me the color that you see going down.
Okay. It's red, orange, yellow, green, blue, purple.
Very good. All right, so the next thing I'm gonna do is assess your ocular eye movement. So I'm just gonna have my finger in front. Oh, I'm gonna actually use the pen. I'm gonna use the pen, and if you can just follow along with it, okay? All right, very good. So now the next thing I'm gonna do is I'm gonna assess your ears. So I'm gonna inspect bilaterally for shape, size, and if there's any lesions. Okay, and now I'm going to palpate the ears for swelling and tenderness. Okay. All right, very good. So the next thing I'm gonna do is I'm gonna do something called a Weber's test, and it's gonna see if there's any like diminished sound, okay? Okay. So I will. Oops. I'm gonna redo it since I can't hold on to there. And make sure that you're seeing. Let me know when you can't hear.
No.
Alright. And were you listening to them both on the equally on each side, or did one side diminish before the other?
I feel like this one diminished before the other one.
Okay. So now I'm gonna do another test called a Ryan's test. So I'm gonna place this part on the back side of your ear, and you're gonna let me know when you don't hear it anymore. Then I'm gonna place this side on the top, and you're gonna let me know when you stop hearing that one, okay?
Okay. No.
Okay.
No.
All right, very good. Now I'm gonna repeat that with your other ear. Oops.
No.
Okay.
No.
All right, very good. All right, that completes the ear part. So now I'm going to move down to the nose. So the first thing I'm going to do is I'm going to inspect for lesions, massing, swelling, bleeding, and if it's symmetrical. And now I'm going to palpate the nose. Let me know if you feel any tenderness.
No.
Okay, the next thing I'm going to do is I'm going to assess for patency. So if you can just, I'm going to close this one, if you can breathe out. All right, I'm going to assess the other side. Breathe out. Very good. So now I'm going to look inside of your nose just to see if there's any swelling, check the color, the exudate, all right, or any lesions. All right, very good. So then the last thing I'm going to do is I'm just going to have you smell this for me and tell me what smell you smell.
It's lavender.
Yeah.
Kind of strong.
All right. So now that we got the nose, we're done. We're going to start doing your sinuses. So the first thing I'm going to do is I'm going to inspect your frontal and maxillary to see if there's any swelling. And now I'm going to palpate to see if there's any tenderness, and you let me know if you feel any. All right, very good. So now the next thing I'm going to do with your sinuses, I'm going to do a light palpation, okay? All right, very good. So now the next thing I'm going to do is I'm moving down to your mouth and throat. So during our assessment, I would have been assessing his breath sounds, which I have this. My chart just fell. And so after I assess your breath sound, your breath smell, I'm going to now inspect your mouth. So what I'm going to be inspecting the lips. Okay, if you can open your mouth wide. Your buccal mucosa, your hard and soft palate, the gums, and the teeth. All right, and now I would have been also using the tongue depressor while inspecting all of that. Okay, so now if you can stick your tongue out. If you can stick your tongue out for me, move it around. All right, very good. And now if you can put your strength all the way to your left side.
What do you mean?
Your tongue strength, if you can move it. All right. And now to your other side. All right, very good. So the next thing I'm going to do is inspect your gag reflex. So I don't need my pen light. All right, I'm just going to have you can stick your tongue in, open your mouth, and let me know when there's a reflex on the posterior side. All right, very good. Okay, so the last thing I'm going to do is I'm going to palpate for consistency and tenderness, okay? All right, very good. Thank you, Mr. Valle, and that completes our assessment.